Everyone, my name is Michelle and I'll be discussing workplace morale. At the end of the presentation, the learner will be able to do the following: identify how workplace morale impacts healthcare and society, determine the influence of workplace morale on nursing practice, identify 3 things that can improve morale, and identify 3 things that can negatively impact morale. So what is morale? According to Business Dictionary, it is the description of emotions, attitude, satisfaction, and overall outlook of employees during their time in a workplace environment. Another description is enjoyment in the workplace is an influential aspect found to boost workplace morale and job satisfaction, leading to a higher work retention, which is important in nursing given the availability of nurses in the workforce. So currently we are in a nursing shortage, and it is very important for managers to take workplace morale into account because otherwise they are going to continue to lose nurses. 2 lists here on things that can decrease morale. First list is from Bester 2016. That list includes boredom and general lack of challenge, employers' financial instability, unhappy corporate culture, poor communication, unclear expectations, and unfair treatment of staff. The second list is from the Social Workplace in 2015. That list includes managers that treat their employees poorly, moving the goalpost, unclear expectations, lack of communication, not feeling recognized for hard work, no clear employee development, an unreasonable workload, inappropriate compensation levels, and high turnover rates. I'm sure you can think of even more things that would impact your workplace morale. Influence on nursing practice. So the shortage of nurses is really impacting our practice as well as morale. So according to Dean in 2017, one staff nurse at an acute trust said difficulties recruiting meant that on most shifts, agency nurses made up 50 to 70% of staff. Nurses also feel disconnected while they're at work. They can feel overwhelmed, unsupported by their managers, and stressed. All of these things create errors to occur, and errors in healthcare are not something we want to occur. According to McNee, 2017, organizations that reported low employee engagement experienced 49% more accidents and 60% more errors. According to Dean in 2017, survey results show that more than half of the nurses said that they only sometimes or never had time to deliver safe care. That's an issue. We should always be able to feel that we are providing adequate, safe care for our patients. Impact on society. So basically, anytime nursing is impacted, society's going to feel it as well. Members of the society will notice if staff is disengaged or if they're stressed out during their interactions. They're going to notice the increased healthcare costs. According to Bester in 2016, issues causing dissatisfaction among employees are more often than not overlooked, generally at the expense of productivity and ultimately at great cost to the success of the business. So the business in this case is the hospital, and if the hospital is having cost issues, they are going to try to compensate that by increasing costs for patients. Impact on healthcare is high turnover rate, financial implications, decrease in patient safety, and decrease in patient satisfaction. According to McNee in 2017, the Center for American Progress estimates that replacing a single employee costs approximately 20% of their annual salary. In addition, the organization will need to bear the cost associated with recruitment and training of their replacement and will face loss of knowledge and expertise that will take time to remedy. How can we improve morale? So avoid gossiping and lateral violence, celebrate success, plan meals during your break times, be aware of the low morale and address it, create a culture of trust, utilize morning huddles to increase communication, and then also increase the amount of time that the team spends communicating with each other. So kind of in summary here, if we're not able to increase workplace morale, the nursing shortage is going to continue and severely impact us. I personally sit on a committee for patient and staff satisfaction at our hospital, and we are looking at ways to increase our morale. I hope this presentation was able to show you how morale can affect our practice as well as our patients. I hope you can make a personal effort to improve the morale of your workplace. If you notice, I have a quote here from Wilkes et al. Job satisfaction is a focus in nursing as retention of nurses and workforce shortages have become increasingly significant issues. So we know it's an issue and it needs to be addressed. Here are my references.